Good. All right. Well, we're at 5 past, so we might get going. And if a few more people join as we go, fantastic. So welcome, everyone. Thanks very much for joining Kasna's healthcare webinar. I'm assuming at least some of the people in the call are probably in lockdown in the various places that are. So hope you're all staying safe and connected in these times. Just before we start, I'd like to thank all the work that went in from both the Kasna team and the Google team in the last 18 months. It's obviously been a pretty insane journey the last 18 months, both in the healthcare sector and the tech sector. And while we're not going to rehash that 18 months for the next hour, it's given us some really interesting perspectives. And I think that's really what we want to share today in terms of the agenda. So what we're going to do is I'm going to spend about 10 minutes just introing a little bit on our capabilities, but focusing really on, I guess, some of the challenges we've seen in healthcare and some of the issues. We'll also cover a little bit where we found kind of Google Workspace and Google Cloud have been helpful with that. We're then going to drill into something a little bit more practical, and we're going to spend 10 minutes each on 3 use cases that we've drawn from the healthcare industry. Those being safety huddles, which is a pretty common mechanism, outpatients in a remote world, which again is something commonly we've seen people approaching in the last 18 months, and finally a little bit around legacy clinical data and some of the approaches to managing that. A quick note as well, there are 2 demos. The team's been up late sacrificing some frozen chickens to the demo gods, so hopefully we're going to get some really nice smooth demos come out of that today. And at the end, after the use cases, we've got kind of 5 or 10 minutes available for Q&A if you've got any questions. Great, so without further fanfare, I will move on to a quick intro. So Kasna is part of a house of brands called Mantle Group, which is actually one of the fastest growing tech companies in Australia at the moment. At a bit over 350 people, we've been recognised by companies like AFR and Great Places to Work Australia. Within Mantle Group, we've kind of got a bunch of technology specialities that bring our area of market expertise in that specialised area to market. And for Kasna, we're a premier partner of Google Cloud, so that's Google's highest tier of partnership. We're also the largest provider, Australian-owned provider of Google expertise to market, particularly covering both the kind of Google Cloud side of things, but also the collaboration side in terms of what used to be called G Suite, but is now fondly referred to as Google Workspace. In terms of a quick overview of our capabilities, we've put Google Foundations into 3 of the big 4 banks, some retail organisations, and increasingly worked with a bunch of different healthcare providers. That's really across hospital groups, medical tech, but also some aged care scenarios as well. In terms of what we do there, we've kind of got a very, I guess, technology or platform-oriented view, which sees us putting in infrastructure, data foundations, or even more digital workplace and collaboration platforms. But then on the other side of the fence, and you can kind of see on the right-hand side of the slide here, the associated value add on top of that platform. So from an infrastructure perspective, we might be building some apps or some app experience for the business on top of that. From a data perspective, sorry, just admit this person, if someone can do that in the background, thank you. On the data side, that comes down to things more like insights for business. Welcome, Simon, by the way. And then on the digital workspace side, it's really more looking at that advanced customer experience, or in a healthcare context, we'd probably be talking more about advanced patient experience. But also employee experience is also really important as well. And when we talk a little bit about some of the healthcare settings, you'll definitely see that come to the fore. So moving on from that, just to cover a little bit, I guess, some of the key challenges. There's quite a few bullet points in here, but we've kind of broken it into, I guess, some common themes. One of the key challenges, I think, across the industry, but certainly we've seen in the healthcare scenario, is a lack of true collaborative tooling, and this has become apparent in a few different ways. Certainly, when COVID first hit, I think there was a big focus from organisations on remote working as opposed to true collaborative working, and we've seen ideas like in-document collaboration become really important, particularly when we're trying to affect an outcome. That ability to collaborate together in documents, very, very important. One of the things we see increasingly sapping productivity is things like emailing different versions of documents around. And that has been something that's probably been a big source of consternation, both in the healthcare industry and in general across technology. I also saw a recent study from 2020 looking at employees' engagements with different tools. Employees are actually kind of 3 times more likely to say they want to collaborate in document rather than just do another video conference. And in the scenarios we find ourselves in now, on video conference after video conference, actually having that mechanism to get work done productively together in documents really key. But one of, I guess, the things that hampers that is, if you can't treat all documents on all devices equally, it becomes a really difficult equation. So having a scenario where you can support kind of all the different types of mobile devices and all the platforms together is really important. The second tile is really about, and I think COVID definitely exacerbated this, trying to create ad hoc solutions on the fly. So, a lot of us work in or with technology departments in healthcare settings every day, and they're already exceptionally overburdened with the amount of technology projects going on. So getting in the queue with IT can be a real challenge. So how do we find a way to empower the users within an organization, but actually keep all of the kind of private health information we're responsible for secure? So kind of balancing that equation for a lot of organizations difficult, particularly with the technology knowledge gap that might exist kind of in the departmental business units. And certainly that's a key challenge we've seen a lot of organisations trying to address. The third tile around data silos, there's always a new system being added. You've got your kind of PAS and EMR, perhaps some spreadsheets. You've got kind of legacy data going back up to 21 years. All of these different systems sitting around, it can be really, really difficult to get insight across those disparate systems. And once you start adding to that things like kind of ERP and financial systems, which can tell you, maybe you're looking at the efficacy of a certain type of interaction with a patient, maybe you also want to understand the financial implications of that as well. Getting visibility across all of those systems is really, really tough. And certainly on top of that, we've seen with a number of the healthcare organisations we've worked with is patient experience is not necessarily well understood in data. So you might have interactions with patients where they can give feedback, but how many different points of data, how many dimensions of data do we have to truly understand the patient experience we deliver as an organisation? A couple of last themes that have become really, really consistent, particularly in the last year, operational efficiency. So particularly as healthcare providers have kind of had to scale to meet the demands of recent times, maybe they've introduced some expensive manual processes. Those can be difficult or unwieldy to work back out of the system. Particularly when you consider the cost of incumbent technology providers can be high. So the portion of budget going to those kind of existing agreements and hardware and software can actually be a large portion of the IT budget at times. And finally, I think one of the things that's going to come out in the use cases we talk about, how do we get that kind of seamless connectivity for workers? So if you've got a lot of different remote working and collaborative and data solutions, how do you get seamless integration across those solutions so that for a departmental worker, it's a little bit easier for them to kind of use those and there's less of a barrier for entry. The last one, obviously a critically important one, how do we handle data security? There's obviously regulatory compliance is a big thing. But on top of that, more and more nefarious actors and ransomware attacks and, people looking to disrupt services, all of that on top of the patching and updating that technology departments are having to do with some of these older incumbent systems, it's a very, very complicated equation around data security. And so we're seeing that as kind of a key struggle and certainly a big pillar in the challenges that need to be overcome. Great. So just moving on from that to some of the trends, I guess, we've seen around why some of the organizations we're working with are adopting Google Cloud or Google Workspace as a mechanism to combat that. The first one's really around enabling collaboration for patient outcomes. And, if you look at Google Workspace, or what used to be called G Suite, it's kind of got billions of users worldwide when you kind of tally up all of the free users in the system. So it's a very well-known, scalable system for people to use for collaboration. And increasingly, it's being used in the healthcare space as well. On that topic, I think one of the things that we've seen in the industry lately is the number of new healthcare workers coming out of tertiary institutions that have actually kind of grown up using Google's tooling as well. So there's an increasing amount of native Google Workspace users coming out of tertiary institutions that are now kind of influencing that desire for tooling. And certainly if you look at some of the surveying of different productivity solutions, you'll see that in that younger bracket that are coming out of tertiary institutions now, there's obviously a much keener preference around the tools that they were used to in university. Look, one of the other things I mentioned in challenges around in-doc collaboration, it's kind of a critical area across devices where Google really excel, and certainly the solution they provide is best of breed. I don't know about the rest of you on this call, but I certainly worked in the past in organizations where common practice was emailing different versions of kind of word processor document to one another. And, it could take up to 2 to 3 weeks to actually get a document together. Fast forward to the modern scenario where you can kind of get 3 or 4 people in a document together, working seamlessly in a great user experience, and your ability to produce an outcome for a patient very quickly but becomes a different kettle of fish. And certainly that's one of the, I guess, the outcomes that will be, or one of the use cases we'll be unpacking today. Look, I think lack of reliability with incumbent providers, probably another thing we've seen a lot of. In fact, we recently had a head of digital say that people are just expecting poor experience when it comes to their existing provider of productivity suite. And, an outage or an unavailability based on an upgrade would kind of be something that they would just expect to happen. I guess one of the final points on that first tile around collaboration and patient outcomes is that what we've seen time and again is that the intent around people collaborating is actually sharing of data. So looking at Google Suite here and going beyond the traditional kind of productivity things of sheets and presentations and documents, there's also tools which we'll talk a bit about later, like Data Studio or AppSheet. And these tools actually are where it starts to come around the problem of letting people create their own solutions. So they're really tools where people with low technology skills can actually create a secure solution to collaborate around the data. So really interesting areas of work as well. In fact, one of the orgs we've been working with recently shared that actually used AppSheet to create a COVID contact tracking app that they'd been waiting for delivery from technology for a long time, and they were able to really quickly create that solution and bring it to life. The second piece on insights is obviously, that's a core differentiator for Google's stack, particularly on the data side. You've got technologies like BigQuery sitting at the heart of Google Cloud. For those that don't know it, it's kind of their key serverless data lake offering, still the most cost-efficient offering on the market, been around for around 10 years. On top of that, though, I think where it's important is extracting value from that data, and where Google's really well known is things like AI and ML technologies. And here we've seen a number of use cases. So sentiment from language using natural language processing. That could be, what are people talking about and how do they feel about it, to get some patient experience data from call datas or emails or transcripts or something like that. It could be taking meaning from images, so invoices, x-rays, prescriptions, handwritten notes, bringing that data from its current unstructured format into structured data or semi-structured data that can then be analysed and interpreted. It could be using video to detect faults or behaviour or as indicators of certain preemptive events that we want to take action on. All of these require centralised data capability, but more importantly, they're easily activated in the cloud, and certainly Google's cloud offering is designed to make that easy. The last one, and I don't want to spend too long on here, but certainly we talked about in the challenges, security being one of them. You know, everything from having a cloud offering that's managed so you don't have to patch it, using technology like Google's Chromebooks, which certainly have a much smaller security, I guess, perimeter than some of the other types of devices out there, but really, really good for frontline workers. And then kind of simplifying the whole identity stories are all things that are broadly packaged into Google's offering, and certainly things we've seen a lot of interest in. That's all great in theory, though. So with that, I might kind of wrap up some of that more high-level items, and we'll drill into some of the details. So, James, I'll just check: are you ready with a bit of a use case journey there for Safety Huddles?
Yeah, for sure.
Right. I shall stop sharing and hand over to you. Actually, sorry, there's a couple of slides first.
Yeah. I'll quickly talk through that. So, as Simon sort of mentioned, the first of these sort of 3 case studies that we've got relates to safety huddles or clinical huddles. And so huddles are sort of short stand-up meetings that are used to, I guess, share information about the upcoming day or past events, and highlight any risks or concerns that team members may have. And the challenge that was described to us by some of the providers that we've worked with really relate to that shift to remote working, and ensuring that team members can still communicate with their teams effectively, even while working from various different sites, whether that be from different clinical sites or just working from home. Cool. So if we just move on to the next one, sorry, Simon. There we go. Cool. So some of the challenges that we've been looking at in regards to clinical huddles and just generally with sort of team-based collaboration and communication really is focused around the reliance on email as a primary means of communication amongst most of the healthcare providers that we've worked alongside. And that sort of leaves a gap, I think, in sort of the modern era where instant messaging platforms are prevalent in our daily lives. And so what we've seen is a really large uptake in sort of third-party apps within the workplace. So using apps like WhatsApp and Facebook Messenger to organize and collaborate where maybe the organization isn't providing the tools to do so. And so that leaves a bit of a gap when it comes to sort of traceability. And I guess the opacity of those systems and not being able to get a view into what's happening there leaves some concerns around, you know, a decision register if things do go wrong. And it does raise some challenges with regards to, you know, audits and that sort of things if and when things do unfortunately go wrong. So that's one of the challenges that we're sort of looking to face here by providing that sort of like real-time instant messaging platform that can facilitate sort of like collaboration, as Simon alluded to, from within the one window. So working on docs and also collaborating from within the same interface. But then also looking at, I guess, the delays associated with using email. So when you're trying to organize a meeting ad hoc, using those platforms, it really doesn't, I guess, corroborate to, you know, real-time, fast, lean communication. So we're looking to fill that gap as well. So we'll quickly jump to the next one, Simon. So the 2 scenarios that we'll sort of walk through quickly relate to that first situation where, you know, we might have a follow-up to a handover, so something might go wrong. We just want to quickly chase up the team member and I guess address what's gone wrong and look at what we can do going forward. And this is actually something that was described to us through our work with some of the healthcare providers. And they sort of described a situation where exactly as I sort of mentioned, like a handover went wrong and they want to sort of address and follow that up. But due to trying to like, I guess, use email to facilitate that process took a number of weeks. And obviously there are some risks there associated with I guess if that mistake is repeated, not addressed immediately, you're looking at maybe a number of weeks where that could that pattern could continue. So I guess there's a real need to try and address that as quickly as possible. And then the second incident or situation or scenario that we've got relates to sort of a post-incident huddle where you've got members, working together to address something that may have already occurred, and you're trying to bring people in from different locations, again, as quickly and efficiently as you can to address something in real time or on the day of, rather than waiting, again, as I said, like a number of weeks to try and organize that meeting. So I'll quickly go ahead and share my screen. Cool, there we go. All right, sorry, bear with me while I present my window. Great. Cool. So as I mentioned, so we've got this first situation where we want to try and reach out to a team member that's, I guess, where something not necessarily gone to plan, and we just want to address that as quickly and effectively as possible. And again, these are all using very simple tools to achieve very simple outcomes, but they're outcomes that aren't currently, I guess, able to be achieved as described by some of the providers that we've worked with. So in this situation, myself, Dr. House, as I'm sure many of you may know, we're reaching out to Robert Chase. We're trying to understand, what went wrong and address that issue as quickly as we can. So I might, just message Dr. Chase and say, hey, look, are you free to quickly discuss the handover that took place earlier and I guess address that incident? And as you can see, it's, again, just, I guess, highlighting how quick and easy it is. I just add that video meeting there. And I can instantly go in there and have a quick chat to them. But in the instance that they're not free of right now, you obviously can schedule those meetings, and rather than, I guess, having to rely on emails and actually try and communicate that availability, we can use things like chatbots to try and expedite that process. So I can open up the Meet chatbot here and just say, hey, schedule a quick meeting with Robert Chase for tomorrow. And that'll prompt a number of different options that I can choose to actually schedule that meeting. So we should get a quick prompt here, but in the case that doesn't work, oh, there we go. So as you can see, I've got a number of different options. I can go, look, tomorrow at 10 a.m., that sounds pretty good. I can choose that, and then that should actually create that and provision that meeting for me, and you'll be able to see that should pop up right there, and we can actually see that in our calendar right there. So as I mentioned, very quick, very easy, but I guess that's the purpose, is to provide simple tools to get things done as simple and quickly as possible. So moving on to the next scenario where we're trying to bring people together into a group, we can use the rooms down here. And it's probably worth mentioning, rooms is actually getting a number of different updates over the coming months, and it'll actually be renamed to spaces. But if we create a room now, I can add my colleagues and any chatbots that we've sort of used there, and then we can just create a quick room name. So say, for example, we've got an incident that's taken place today, and we want to quickly review that. And then you can also add like icons and emojis here. So we'll add that there and go ahead and create that room. And so here we're actually able to share documents from within our drive. So we've got an incident report template here, and I can sort of select that and post that in the chat. And we can just say, hey, let's work on this and try again get it done by the end of today. And I can go ahead and share that with everyone else. We can actually open that up in the chat. And this is really what I think Simon was referencing before, where we've got your in-document collaboration alongside your sort of communication with the team, all in the one window or view, which is I guess a great way to avoid having to get in meetings and I guess avoid the fatigue associated with endless back-to-back video meetings. So within the room itself, there are a number of different, I guess, functions that we can talk about. The first of which is obviously opening this up here, and we can work there. But we've also got files that we post in here, and we can add folders to add a little bit more structure to that as well. And then finally, we've also got tasks. So, if I want to say, all right, let's organize a follow-up for tomorrow, I can sort of add a date or time associated with that task. I can assign it to either myself or Dr. Chase. So for the purpose of this, I'll just assign it to myself, and I can add that task from here. And then that'll like post a thread within the chat as well. So there's visibility from I guess for the rest of the team as to what's going on. And that's a really easy way you can track tasks for the group. Again, all within the same window and interface. And you can actually see that task is then added to my my tasks up here, and you can see I've got the same task for the same day again. But yeah, I think without further ado, that's pretty much concludes the I guess the ease that you can organize those quick ad hoc meetings and also bring people together to collaborate around the same document and work together without, again, as Simon mentioned, having to actually jump in a call and you know, chat about it and try and avoid the fatigue associated with that. Cool. So I'll hand over to Zen to walk through the next case study.
Awesome. Thanks, James. Zem, I can just share the slides again. Hopefully it'll come up now.
Please. Thank you.
There you go.
Yeah. A little bit of a delay, I think.
Hang on, let me try again. Resume presenting. There we go.
So yeah, the second scenario, a case study we're showing today is about remote clinics. So from working with our clients, it was imparted upon us as how much the COVID-19 pandemic had unforeseen consequences on their systems, which were largely in-person and paper-based. These systems, which function well on-site, the requirement to work remotely presented a number of challenges. So as to that end, so healthcare providers require a solution to assist their staff run their clinics remotely and help manage the clinic and clinical resources when operating in person. Go to the next slide for me, Simon. So the pain points and aspirations. So the one of the main pain points is provided to us by our clients was no visibility of the patient journey throughout their time at the clinic. So they're described as essentially a black box. Someone checks in for the day and then they have no clue where they are, what they're doing. For example, one of our clients had a physical whiteboard to schedule patients in their clinics. During remote working, clinicians did not have access to this information, as normally it would just be on. They could just walk out, look at the whiteboard, go, this is the next patient. This required them to contact administrative staff frequently, and that's slowing down the process and how they manage patients throughout the day. Another pain point was restricted access to systems. So there is a reluctance to provide access to scheduling and back-end systems for security and privacy reasons. And this has also necessitated the need for these manual and paper-based systems. Where the aspiration is, where we want to go tomorrow, we want to provide a journey board, provide clinicians an overview of a 360-degree view of the patient's clinical journey throughout the day and where they are during the day at the stage. It was also one thing, healthcare workers are very intelligent and capable. This was very much has been highlighted by their tenacity and how they've handled the pandemic. They know what is required to perform their jobs. They just need to have access to the right tooling. With that in mind, we'll be demonstrating a clinical dashboard using an out-of-the-box no-code solution called Google Data Studio, which provides an ad hoc and easy solution that without the need for heavy programming or a long discovery and implementation phase. If you could stop presenting, Simon, I'll present the dashboard. Thank you.
On yours.
Hopefully that'll work. Yep.
The light jazz would have come in handy for this bit.
From this first screen, this is a really quick high-level overview of all the clinics that are operating for the day. As we can see, the total number of patients, how many are waiting. We can also see a view down to different clinics. So, for example, oncology, surgical prevention, and urology. We can also see by simple graphs where everyone is and how they're tracking for the day. We can see follow-up status and also the languages spoken. And the benefit of this solution is pretty much a drag and drop solution. So we can quickly just add in another graph, and we want to see who has pathology tests booked for today. There we go. We can see that, how many have been booked, how many are required, and that's very quick and easy for administrative staff and clinical staff to quickly adjust these solutions to meet their changing requirements. The second view is more of a granular clinic view. So again, this is all clinics, but we can drill down to individual clinics. We can also drill down to individual clinicians. So for example, if we want to see all of Rose's patients, we can just see that Rose has one patient today, and we can see it's a telehealth and it's already finished. And if there's any follow-up required, and we can already see that's been booked, and if there's any special notes. We can also drill down to the specific nurse. So for example, if we want to see Bruce's patients for the day, we can see he's been provided for, and we can again see that very, very quick and easy granular view. And then the final one is down to an individual patient. So we can see Tina, we have instant access to their EMR as necessary. We can see that they've got 2 appointments scheduled for today, surgical pre-admission and a urology appointment. We can see that they're checked in and for one appointment, and they're already in an appointment. And we can just see, we can also quickly see the languages spoken and any other follow-ups required. And as I said, this is out of the box, just drag and drop. So currently this is back-ended by a Google Sheet, but you can back-end it via a database or any number of other platforms. So we want to highlight how quick and easy it is for staff that know what they need and how capable they are to do this solution for themselves. With that, I think I'll pass over to the next presenter.
Awesome, thanks, Em. Yeah, I think Troy is up next. I'll just get the presentation back up.
Yeah, I can present as well, Simon.
It's up to you. I've got it. It should be up and sharing if you.
Okay.
Yep.
Yeah, that's cool. Yeah. So our last, I guess, case study we're going to be looking at here is the legacy clinical data. So as anybody who's worked in hospital or healthcare for any amount of time understands the number of systems and sort of the sprawl of technology that's happened over the last 20 years. It's never really been a problem necessarily of having enough tools or technology. It's just I guess the sprawl and the absolute dimension of legacy systems as well as siloed systems. And of course, legacy data formats are a major issue. So with all of this, it becomes very complex to bring that together to ensure regulatory compliance, to ensure PII and health record integrity. And so in this use case, what we did with the customer is look at pulling together the legacy clinical data that we're moving over to an EMR, but they of course still had old systems that had data. So do you port that all into your EMR? What do? Do you just leave it there? Do you just hope that no one asks for it, or just make it completely useless? So we looked at that, and there are solutions in Google which provide that, and that's what we'll be talking about today. So if we could just go to the next slide, Simon. Yeah, so continuity of care. So turning off those old systems. EMRs are great today, but they are, they're a 10-year investment, and then they usually will get replaced, and I'm sure they'll get replaced in the future. What do you do with those medical records? How do you ensure interoperability as you start spanning into that longitudinal view of a patient? And then that pulls in your compliance and security issues around that as well. So you've got different formats. How do you maintain integrity from a security and compliance point of view? And then you've got different formats. So the X12 standard is 40 years old. HL7 V2 is 30 years old. That's hard to believe. There are things about FHIR that have come in, but the adoption isn't that huge. Plus, you still have 20 years of records that you have to either port in or manage. So today, what we want to talk about is moving forward with Google, how we can solve that interoperability issue. We can reduce the time and the cost to make those records available, and to then put that information available to as we saw from Zem, start creating views on that information. And then lastly, clinical and operational data harmonization. So clinical records are obviously very important. The health record is super important, but if you got to think about the iceberg of information that exists inside of a hospital or healthcare setting, there's a huge amount of operational data, bed information, logistics, all of that, huge amount of data, which how your institution actually operates and provides better patient outcomes in the end is in that operational data. So harmonizing that together will give you sort of the best of both worlds, and we'll talk a bit just quickly on how we're proposing to potentially do that. Next slide, thanks, Simon. So Google has what's known as the healthcare API. So in our use case with our customer, they had that exact problem where they were moving to an EMR. They had a lot of legacy systems, including, the very raw, very legacy, almost spreadsheets or CSV files just on a file system somewhere. They're moving that into an EMR. Do they bring those 20 years of records into that EMR and pay for that exorbitant cost to bring and harmonize those records into the EMR? Or what we propose is the healthcare API, which is an easy mapping interface to take all that historical data and incremental data from systems like HL7, CSVs, as I mentioned, and put those into a standards compliant data store in Google Cloud, which then the EMR can then pull into, as well as enable then other use cases like using that data studio to view customer outcomes or logistics information and operational information. So Google out of the box provides, and we'll see very shortly how easy it is to just simply take from those disparate systems into HL7 compliant store or FHIR store or DICOM store. And if you're not technical and you don't know what sort of all those sort of mean, I think anybody in the health, I guess, IT system would know what all of those are. And they're basically formats. Some of them are legacy. FHIR is really sort of the standard, which is moving forward. But it is that harmonization of that data and bringing that in together into a central store, which then your modern systems that you're moving to your EMRs, your electronic health record can pull into. And of course, there is all the security and compliance and thought around that support for that those data stores in the cloud with high security and, in the US, for example, HIPAA compliance around these data stores. Cool. Next slide, thanks, Simon. So this talks a little bit, what that actually looks like in a bit more in an import and an export view. And we'll see in a second, one of the really powerful things you can do out of the box is then de-identify these data stores. So if you want to leverage operational, or you want to have research to look at those historical records, you can de-identify those and provide those to research organizations or to other systems which maybe aren't approved to actually hold those health records. Thanks. Next slide, Simon. And this is an example of very easy how you just simply, once the data is in the Google secure store, to use the healthcare API to de-identify those data sets and make those available. Next slide, thanks. So just going back again to that, bringing forward that legacy data and the truth about data, which is that it's very messy. You've got EMR and claims, you've got social, you've got genomics data, imaging data, all of that is in different formats, and it's really that mapping. And Google has spent, the last 20 years managing lots of different types of structured and unstructured data. So they have this down as a science now, and it's very easy for developers and for us to bring those data sources and put those into those compliant data stores. Next slide. That also includes operational data sets. So moving that into those, not just the healthcare data sets, but now you can put that into BigQuery and have the petabyte scale of things like BigQuery for bed occupancy, drug costs, capital assets, patient satisfaction metrics, and start comparing and producing your own analytics and metrics off of that data that's all centralized. Next slide, thanks, Simon. So pulling that all together, what we proposed and what we have done for that customer is that mapping a transformation, again, historical data and incremental data, by mapping not just the terminology, which, as some people may know, terminology is a whole another branch of healthcare in terminology server, those sorts of things. Mapping that, as well as field mapping, unit alignment, clinical extraction, all of that happens in that transformation layer from those formats into a FHIR compliant, or if it is need to be HL7, can be that format for then use by the rest of the organization. And with that, I think that's everything for that use case. Back to you, Simon.
Awesome, Troy. Thanks. Fantastic. I know that was a few quite different use cases and a fair bit of, I guess, general challenge at the front. Did it spur any questions for anyone at all? No, I'll give everyone a couple of seconds more for questions. Not even, where did you get that fancy cardigan from? No.
Very good. Yeah, look, this is fantastic. I'm learning heaps. It's Andrew here. Just a quick one, if I can. What's the role, and excuse my ignorance, but how does, like, there's a degree of RPA behind this as well? A lot of robotics that can suck out information and place it elsewhere and so on?
Yeah, so RPA, I guess, is you could have a separate solution provider with RPA. A lot of that's really built into Google's mechanisms. So things like image recognition and some of the other tools that they have, they kind of come out of the box. So with Google, you often don't need that separate solution to create automation. Troy, I don't know if you want to give a slightly more technical view on that.
Yeah, so Google sort of specializes in batch and streaming data ingestion, and that's in a general sense, but certainly in any database, let's say you've got legacy databases, let's say you've got wearables, for example, that are streaming health information, beats per minute or things like that. Those are all patterns which are very easily consumed already by Google in a number of different formats. So once that's ingested and used and gone through that ingestion layer, can then get dropped into BigQuery for that operational data, or drop straight into that FHIR database for clinical health record data. So yeah, again, very general patterns, but I guess you're not going to probably have a database which isn't going to be able to be read or pulled, batch loaded into Google. From that perspective, and from an automation perspective as well. So, nightly dumps, or you can get that streaming. There's also Data Stream, which Google just released, which is a change detector, change record detector, which can sit on those databases and in real time, get those updates. If you still need to keep a database live, you can still, be archiving that result or that transaction into Google Healthcare API and be useful for analytics and maintain that operational system.
Mm-hmm. And in some of these use cases you showed there, how do they scale? What's their capacity to scale down, in the sense of, I can imagine that organizations that have larger budgets, such as Eastern Health or even eHealth in New South Wales, but more down to your smaller concerns. How does this, is it readily scaled down as such?
Great question, Andrew. I think one of the great things about Google's Workspace tooling is, the pricing works really well all the way down to 5 or 10 users. So it scales from the tens or hundreds of thousands all the way down. The other great aspect of cloud computing is if you don't use it, you don't pay for it, essentially. So, Google's cloud native approach to things like BigQuery. So with some other providers, you might put a bunch of data into a system and pay for that storage. With Google's approach, you only pay when you query it. So you can put a whole bunch of data in, and if you're not using the data, you won't get charged for it. So it does the kind of cost point does work all the way down to smaller organizations.
Thank you.
I guess the only other thing to add on the RPA front, and hopefully I'm not going to get killed in the background by Google marketing for this, but they did announce the acquisition of Automation Anywhere, which is an RPA solution. They haven't announced any plans for it yet, but I'm sure there'll be more coming on that front. Great. Thanks for the questions, Andrew. Anything else from anyone else? Any other questions? No, wonderful. All right. Well, one final slide, if I can click in the right place across these screens. There we go. So just a quick summary, and we will send this recording out as well with the pack, so you can have a look at it. Just a couple of key takeaways I thought worth thinking about. The first one is, where we found a lot of bang for buck working with the healthcare providers we've been working with is looking for friction. So things like the safety huddles use case, the remote outpatients journey, those things were like, is there a laborious process or manual workarounds? Is there a high risk process? Or have you got people manually collating data for, for reporting of some kind or compliance? They're all areas of friction that we can look at together to determine if there's if there's a good thing we can work there. And then when we're working the solution, it's always kind of patient experience or employee experience are probably the top two things we think about. And it's flipping that friction into some patient journey mapping, or looking at the technology constraints, or maybe even doing some data mapping or data consumer mapping. We can pretty quickly come up with an idea to try and test a hypothesis around, can we fix this quickly and cheaply in a way which will positively affect patient and employee experience? The answer is often yes, and in fact what we're offering at the moment is a discounted workshop for us to come and work with you and have a look at what both the technical and the human constraints of that scenario might be. So Google have kindly offered some funding, which will complement with some funding of our own to help try and find some ways to unlock some value. So if you are interested, obviously my email address was on the invite. Feel free to ping me directly, or obviously team@kasna.com.au as well. We're more than happy to just have a chat, even if you're just looking to spur some ideas or get some general info as well. Great. With that, look, thanks again for your time today to everyone. I know it's busy time, so thank you very much. Hope it's been of value, and I look forward to another conversation soon.
That's great. Thanks very much.
Thank you.
Thank you. That was
Thanks,
great.
Son. Thanks. See
Thanks,
ya.
guys.